It's a time for a health presentation, and we want everyone to pay particular attention to this presentation because it affects almost everyone, apart from the little ones.
Right. I'm standing here because we're still learning about our bodies, which is part of Jesus' ministry. And when Jesus was on earth, health ministry was one of his main ministries. He healed people who couldn't have babies. He was able to help them to have babies, and people who died.
Sabri, Jesus Christo be nabi. If you say yes to buy and na ayaresa ne dwumadie no mu fakese nara na awo nso so yade ana eda ne koma so obo a wo ma na omu ni afun anwo aba no ebinum bebre enya emma e wo sa dwumane bre no mu eno nti egina ha na ye beka bibia fa sa de no ho.
Right, I am going to talk about today fertility, male and female fertility.
Yebeka ebibi afa awo ehun emma ne mema kwan awo ho.
And when we talk about fertility, basically what we're trying to describe is one's ability to literally have a baby.
Say you can't say obi a wotumi wo a just kwan obi a wotumi wo. Because worry aya na enim say emma no nkwan na enwo.
Yeah. So basically, one's ability to have a baby is not about being able to get pregnant or being able to carry a baby halfway. It's actually being able to have a baby to the full. That is what fertility is about.
Yes, obi asabia wotumi nyinsan. Obi nyinsan a nyinsan no wontumi mfa nkona wie na sei.
So therefore,
ka obi a wotumi nyinsan a de nyinsan no kwa wie ye wo ba no. So
if someone is said to be infertile when they've been trying for at least a year and not able to get pregnant, both men and female.
Say our for etnase nasa womo epe awo nasa womo yana afe na womo nya bi a womo na yetumi ka se bi asebia womo awo ho ayede ama.
But for a woman who is over 35 years, we limit it to 6 months. If after 6 months you've been trying unprotected sex and you've been trying and then you're not able to get pregnant, after 6 months there is a concern. So for a 35-year-old or over, that is when you are deemed infertile.
Say ya di eba memu a obi a wanya mfie aduasa ensia na watena ase na wone ne kun sebe won abomoden ase ye pese yinsen eno nti wone ne kun hyi a won mo ho ban bosumi nsia na se maaya na che se ya de a ha adwen kakra.
So, and then also people who have miscarriages too are deemed infertile as well. So when we say somebody is pregnant, pregnancy is a result of some processes.
Say ya kan so obi enyemo a ensakraya hura ekoso woni padua ni.
So first of all, the woman's ovaries will release an egg. That is the first stage.
Ni edi kan kra ne se oba no se wo hwe emma se ne nyame ye na awode no.
That's right. And then the next one is that the egg will have to travel through a tube down to the womb. And then the man's sperm would have to meet the egg and then fertilize it.
Na wodi no abeka kosua na wato no na aka bom eno na nyinsan ahase.
And then the last bit is that once the fertilized egg needs to implant into the womb. So if there is a problem with any of these processes, then there will be a problem with fertility.
Edunti no just beto awodi no mu a ehọ na anyinsan na hyase a abofra na nyi this obi entumi enya saa kwan no se o ha obi baabi a ena na anyinsan ho aye.
Right, so we have two types of infertility, a primary one and a secondary one. A secondary infertility is there are people who are able to have their first baby perfect. After that, none. That is secondary infertility. Now, some of them too, they are not able to have at all.
Yeah,
So
well,
primary is one who's not able to have. Secondary is one who's able to have the first one, and the rest not able to have anyone.
Sabi onyinsen baako a no wo ba saa ba baako no a ontumi nya nyinsen ni bibio ono no ewo yese ne haw no yesoronko ene ye wo obi nso so a anyinsen ne ebi ma bi kra na brem kra wo nyinsen da ono nso so eye baako a idi kan.
It is very common. I mean, infertility is common. Most of all of us have probably been through it before. And therefore, when someone is going through, it's not any strange thing. It's very common, and most of the time, it's solvable.
And to say, obi eware na se sebia anyinsen ne ma enya ade a enwanwa nipa ne bebre e na akosa atibia no na mom so hu ne ho kwan na ofa so a na chese wa ade ho afisa oha.
So is it really only the woman's problem? No.
Most of the
time, it's the woman who would normally raise the alarm. So then the attention goes to the woman. But it is most of the time both of the parents. So basically, about 1/3 of couples, the problem is caused by the men, and another 1/3 by the woman, and then the rest are sort of mixture of problems.
I don't see a chichemu miensa, near Dicano, a beer, a oban how, near Tossum you near bear man how, near Tossum Yansa, ya how a homo beer.
Right. So let's come to the men. I'm going to concentrate on the men for a very short time, and then we go to the woman. So what causes infertility in men?
I don't know, yeah, mamma no nay, come on, Matthew, Salmon, so totally be among you. I don't see a barrier near it's me bar, moon to me, and
right, so we realize that with the men, because you have the scrotum, which is the scrotal sac, and then the testes that produces the sperm. So basically, the sperm has to go through a cord all the way to come to where it normally comes out. If there is any problem with it, where the sperm is produced or the tube that brings it out, you can have an issue with fertility. Sperm is produced. That's right. That's right. And one of the main causes is when you have groin surgery or when you have trauma to the scrotum. Sometimes it's very simple. Somebody will just boot you like that, and that will be it. A child, especially.
And they say, Ebia na wo mem wa bre mu mu di agro na wadamfo bi de ne nan abbo wa ya se ananse bi ayare bi same yare bi ese de same na wo ho ahono na yakoyo operation bi na bibi na entin bi ho aka e ba ne sa e de sa wo ha.
And then also infection. If you know people who don't look after themselves, if you're not supposed to be sleeping around and you do and you catch infection, that could affect you in future.
And mema na sabia yesi so a na ye de ma no aye gala ye bo bonkum ni fa afia kwasu adwoa ne ye yesa na ye fa yare
so something like
sa na nyina na wonya yare a afi wo tena se wa ware na wo hwehwa wo no a.
That's right. And then you blame the woman, but it would be you. Right, so infection like chlamydia, gonorrhea, tuberculosis to the side can cause. Tuberculosis is not only chest. Tuberculosis is some sort of infection that can affect any part of your body. So if you get tuberculosis in that area, you will not be able to have children.
Say dear Yatio, yes, will be a wabone, wabon, wabo wabone, sa and ya wabone and ya kukunquani to Mr. Nyasayarene, Sabi was
wherever that bacteria lives is where the tuberculosis is.
Abuana wabone by Yahara was the call will share no more, who to me,
and you can get it from somebody.
Wow, and Yaria to say gonorrhea, nay, I just I will bonena ye mranti brem yedino.
So we have testicular injury, which I've already talked about, that manifests itself as in swelling of the testicles and bleeding around them, and eventually you will not be able to have children, because if the testicles has a small injury, you could be screwed. That would be
ɛno
it.
nti no sɛ bihwa no mu mma no sɛ biribi ketewa bi te kyema wɔ ho a ɛtumi ɛma yɛawɔ
Because if any time there is not enough blood supply to the area, you would have a problem in that
sɛ
area.
biribi ketewa bi a ɛbɛte kyema ɛma mogya a ɛsɛ ɛkɔ hwaa no mu no ɛso te a na kyerɛ sɛ na nsunsuansoɔ ne sɛ ɛma yɛntumi ɛnwo.
Yeah, and another very common things about them, I'm going to tell the mothers, they are your children. One of the things that we in my area, surgery we do on the children is torsion. We normally get that as emergencies. Now, this torsion, if it's a twisting of the testicles, if it's not operated on emergency, that child would be infertile.
So akwala bi wɔ no ma yɛ wo no abɛmoa bi wɔ no ma yɛ wo na ne hwɛ aba no
normally it's
wɔnyi meba yɛ wo no na ne hwɛ aba no ɛbɛtɔ ayi no mu a ebi wɔ no ma ɛkyinkyim a yɛsɛ nke tokuro na dɛm ahonte ɛkyinkyim kakra bi na sɛ wa ma wani ama so ama yɛ ntum ni kan kɔ yɛ operation a ɛwɔ hɔ no mo cha a
the thing is, basically, they are not born with it, but it happens for some reason during the work because of the testes is working all the time. Sometimes the kids get testicular torsion, and then they'll bring them to theater, and then they will be operated on. Now, what the child might tell you when this happens is that they have pain. When your child tells you they have pain there, please run to the emergency unit and get it diagnosed or looked at.
Abofra ne beka sɛ wonya ya wo na ya ase so aboba bia wo ba ka kyerɛ wo sɛ na ya ase ana ne hwɛ mu ya ne ya tumirika fa kɔ no hospital na ya mo hwɛ ma no na kyerɛ sɛ operation ya sɛ ya yifiri hɔ no ma nsa na ho nsunsuanso ama wa bɛyɛ bayifo no.
Because recently I looked at like a 14-year-old boy who had testicular torsion, and in fact when we opened up, the testicles had literally been destroyed, and I felt sorry for that child because that child is going to be infertile. They could not save the testes. Just recently, I looked after a child like that. That's right. So the doctor could not save the testes. So you need to take them to the hospital as quick as you can. So that's right. And then young boys, please stop playing around there and don't let people boot you there, because that would affect you in future or kick you there. Okay, another infection is mumps. When kids get mumps, because of the area gets inflamed, and then also it causes a problem. Another one is undescended testicles. That is very common as well in children.
Ne hu sunsanso no wɔ ne hwa mu ɛno nti no sa wan tumi anhwɛ ne yɛ de nso ne yɛ so akeka daachi bi no ebetumi aba sɛ ɛbɛha na wo ɛna abɔfra bi nso so wɔ hɔ no ma yɛ wo no ana ne hwa aba no ne nsa ne yɛ nti sa wo ba ketekete no bɔ modern na hwa ne hwa no mu sɛ dua ne yɛ mienu ɛna egum ana.
Right, because most of the kids are actually routinely screened for that. That's another very common operation we do, and if that is not done within the first 18 months of the child's life, that child will be infertile.
ɛno nti no wɔse operation a wɔmota yɛ wɔ baabi ɔwɔ paa no nti wowo aba na bosome na edi kan na nkosi so obenya afedeɛ wɔsɛ ɔbɔ mmɔden ahwɛ sɛ hwɛ aba no yɛ mienu ɛwɔ mu hu sɛ nti saa bɔ mmɔden afa ne kɔ no wɔn nyɛ no operation ma ne yɛnyi ntum.
Another major problem, another major cause of infertility in men is varicocele. Now, this is when the blood vessels supplying the testes sort of stretches and then becomes long. When that happens, there's too much heat in the area, and that hits the testicles, and then eventually it destroys it. And then it's also manifested by a very big scrotum. That's right. So basically, you can see it when the scrotum is sort of getting too big. you realize that the veins have sort of stretched and become too large.
That's right.
So other causes include sperm disorders, genetic disorders, hormonal issues, when a man is not producing enough male hormones, which is the testosterone.
Hormones are and dry form kakra and I do also so and then I wusumuno.
So then also some medical conditions, diabetes, blood pressure. In the long term, these things can cause, but by that time you probably would have had your kids, so no problem about that.
So
then after all these things, what other basic things can increase your risk of infertility? If you drink alcohol, if you take drugs, if you smoke, and then also sometimes age can affect a man's fertility. Environmental toxins and pesticides, and then radiation and chemotherapy. Okay, so what can we do to make our lives better? It brings us back to Jesus' ministry and what Mrs. White has always told us, and what Elder not told us last week. Eat a very healthy diet and a balanced diet. Try to maintain your weight in the ideal range. The men. Because research actually proves that your ability to produce mature sperms is directly affected by your weight as a man. And then don't smoke. I'm sure we don't do that by God's grace. Don't drink alcohol, like I've already said. Don't use recreational drugs. Where are the teenagers? Don't even try it. And then also reduce stress, please. If you are trying so much and it's not working, it's probably you are working too much. The man, it's partly due to you as well. You need to be really distressed to get everything working well. Okay. So let's come to the women very quickly. So what causes infertility in women? Most of the time, the beginning, where it starts, the ovulation, where the egg has to come out, that is where, if there's a problem with there is an issue with fertility. That is our major problem. That's right. Because if there is no egg released, no sperm can fertilize that egg and there will be no pregnancy. So some of the common problems is when you are not ovulating normally, and what shows that is when you're not having regular periods, or when you are not having any periods at all. So as we all know, one of the major causes is polycystic ovarian syndrome, which is PCOS. No, that one is polycystic ovarian syndrome. Is when on the ovary itself, it becomes cystic, so it's not really producing the egg. I didn't do it because there are children here. Yeah. there is the bit that produces the egg. So it is basically the one common problem of so there's another one, the primary ovarian insufficiency. That's when the ovaries are not, they stop working completely. You know, like somebody who has menopause. Yeah, if it happens before age 40, then there's a problem. Because you know, some people, when they're having fertility issues, they go and they tell them, you know, your ovaries are actually not producing eggs at all. That is what I'm talking about. That's right. But it's not menopause. It's not the same as menopause. It's a whole completely different thing. Right. So basically, another problem, like I said, where the beginning, the roots that the egg will take, and then where the egg is going to sit. If there is any problem there. So now, if you have an issue with the tube that is going to transfer the egg down, that's a problem. And most women have blocked tubes. So you'll be told you cannot really have a baby, get pregnant, because your tubes are blocked. That is another major problem. Yeah. And then another one is if the womb, where the egg is coming to sit, if that place there is a problem there, then again you cannot get pregnant. And then fibroids is another cause. What fibroids does is, because there are some big growths in the womb, it blocks the sperm from going up. So every time the sperm is coming, the fibroids will block the sperms. So you will not get pregnant if you have big fibroids. Okay, so what are some of the things, apart from these problems, what are some of the things you might be okay with all these things? But then what can actually also put you at risk of infertility? Then and again, we come to smoking, alcohol, stress, poor diet, and as a woman, you should exercise. But people who do very vigorous training, you can be affected. You could be affected and may not be able to get pregnant. And then also, if you are too big, you might have a problem with getting pregnant. And then also, sexually transmitted disease. Anytime you get infection, as in, you know, you get it through sleeping around and getting it from people who are infected, sexually transmitted diseases or infections. Syphilis, gonorrhea, chlamydia.
Na da bia wonam na me wo white na mo wodo pua ni nyina ye infection a wonam mema so no wotie nya.
I wish the young people were here. Where are they? Because if you have an infection, you will not be, if you get an infection, it could be treated, you'll be all right, but it will scar your womb and your tubes and you will not be able to get pregnant.
Wonya saya nkama some way they sabi amode kamu hia.
I mean, it's more the kids should really know, the young people.
So mranti won ketesi abremu wonya saya no na wanya no wakone ya wo pane ya wakone am wadure na ekọ ni nyina aye kuro na aye kotwa ewo wawode anum na aye kotwa ewo kwan a YouTube num ni nyina eba ne saa. We are ready, so power.
All right. So let's come to age as well. Does age affect your ability to get pregnant? Yes, it does. About 20% of women are actually having babies over 35. And in fact, when you are aged, it affects everything about getting pregnant. I'm going to tell you what it does. Yeah. So basically, your ovaries, first of all, where it begins, it's not able to work as well as you were a young person.
Now, when you na ovaries, and then
the eggs that are produced are not enough as well.
And Uncle Siano, so I would turn so and also.
And of course, eggs, they are not as strong and as healthy as it should be.
Sania Sabia, me would me jina the akola will be jina has yen to Mirika, or Bekwa Jamiano. Sana and Kosiana me trono, one only the water and one.
That's right. And then also,
Shano, Nidiano, and Wadding.
You are more likely, as an older person having a child, to have blood pressure or develop diabetes.
And as a winnie who are in pins, so now, who pet our one now in your business, so I know soon, so on and say, who bet me with Jabroso, and I
which is fine. I mean, you know, most people get pregnant and they are having diabetes, but they are well managed. But I'm just saying that age affects being able to have children. Because if you realize those of people who had their babies between 20 and 30, they had it really easily, but after 30 they start struggling. That's what I'm talking about. And then also you are more likely to have miscarriages as well.
Miscarriage, kind of say.
Yeah, sorry. So I mean, really, we did some statistics show that, or what evidence shows that if you are 35 and you are trying a baby, after 6 months you should go to the doctor. Don't wait for 1 year, because as your age goes, fertility declines really quick after age 35.
Sister, when you fear the asa, enum. Na say wo pa nyinsanya wotena woni say be mehia eto aso bosumi nsia na sa ama bomodan na ko hu doctor na yenya hu bibi ma. So
things that would increase your risk of being infertile, I've already mentioned some of them: irregular periods and no menstrual periods, if you have very painful periods, endometriosis. That's what Mama was trying to say the other time. Endometriosis is when some of the cells inside your womb starts growing outside the womb, and that's another big thing that causes infertility.
And Sunday, I did abobody. Na ni I person exan ka kire won say anyinsen no awodi enachi na honam bi nso asen afifiri honom eno no nso so etumi ma.
And then again, PID, pelvic inflammatory disease, like that's an infection there.
Yeah,
that would affect your fertility. And then if you have more than one miscarriage.
And I say when you back and you know, and so how.
So if you're thinking of getting pregnant, or if you're thinking of trying, please go and see your doctor. They can advise you about the best way to go about it. They can answer all your queries about babies, and then you know that you're having a good start.
And when you know, so we are not some I want ma. So
then what can I do to maintain or to get healthy and maintain my fertility? Young people, this is it. Those who are now going to have children, you need to maintain a healthy weight. Prevent sexually transmitted diseases. Don't sleep with anybody before you get married, okay? Don't.
Eat
a healthy diet, and then try to get yourself checked up every now and then manage stress. Okay. So that brings us to the end. But there's one thing I always want to say, that, you know, there are all these things there and there are problems here and there. Yes, God wants us to be able to look after ourselves. But in the end, He's the ultimate one who can give us that baby that we want. Hannah was infertile, but God gave her a baby. That's right. So this brings us to the end. Have we got any questions? I'm sure. Just one question. Yes, Uncle.
Media say blue no, say white no, say brown no. Minimness ni bia no so church sa. Na omo chere say Saudi no, o hwe Europe for man no a, Saudi ni ni won so kese. E wo African for man so pass ni Europe for man no. Na ne farba ni ne kofa ba nyina free. Sabio yen toilet na ye kono ofie no. One say yen sheda use water closet ni too much say happen no. Na vapor na free toilet mu ba no. Ene me man nya Saudi no.
Excuse me. He wants also to know that it's about the white or the blue. And he's telling us that there was a nurse who gave a lecture back home in Ghana that he said the white is very common with the African women. Is that it?
And I also church Muzo says, Oba, when you be me shesha bibra. I say,
he wants to know because he said indiscriminate sex around.
We have sexually transmitted infection and pelvic inflammatory infections or diseases.
Okay,
so all of them are infections, but let me tell you, pelvic STDs are chlamydia, syphilis, gonorrhea. These things, you don't get them from the toilet, you get them from somebody else. Syphilis, chlamydia,
syphilis and chlamydia and
HIV number one.
HIV what's not your fisua and albania when a bear man yanshiamudia
right
and a wutuminya fi says the bear man wo yare ni bia
or the
now when ni shia or the mouth.
Right, pelvic inflammatory disease, any kind of infection, you get it down below. Now you get this by any kind of dirt can give you infection even if you don't wash down well. So anything that would grow dirt there would result in infection.
And say why I say ya we yare ni ayase yare no so no say wan hwe so yi a say wan you hu ni wan horo wase ya and ma no so aye sori a ne ye de anka atwade ene ne ma hohoro ye ho say ye de hohoro ye ho ama ya yi no ni nyina de wo how.
So basically the infection that is caused down below is the same. They are all both infections, and any kind of infection down there can cause scarring of your tubes, which as a result the egg will not come down, so it won't meet any sperm.
You see, to the men, right? You need to watch your sperms. Very important. Any sort of load of sperm, that's a teaspoon, produce about 40 million to 60 million sperms, and you only need one to fertilize.
No, Sabia Muhuncio no, atrema ba kono. She said,
So you need to watch. It's important. You need to watch the pants that you wear. No tight pants. Because God put those two things there for a reason. Because it's a very cool area. God put it there for a reason. If you put very tight pants on, you increase the temperature. And therefore, you're not able to produce good sperms. So very important. Men, go to Master Spencer's and buy very big pants. Not the tight ones. Amen.
Was it a Mayan shape?